From WREL News and the Capital Broadcasting Podcast Network, this is your Coronavirus North Carolina News Brief for Monday, June 22nd, 2020. I'm Cliff Baumgardner. Here's the latest from WREL.com. Raleigh's mask requirement went into effect last week, but many residents are still refusing to abide by the order. Earlier this month, crowds gathering closely together outside restaurants in Raleigh's popular Glenwood South area were in part what led Mayor Mary Ann Baldwin to issue an emergency order requiring facial coverings in public. But over the weekend, those crowds were back, and masks remained a rare sight. Baldwin said it's too early to enforce stricter rules like citations, but that the city is continuing to work with Glenwood South and the Downtown Raleigh Alliance to try to get people to comply. When asked if she was considering stronger enforcement of wearing masks when social distancing isn't possible, Mayor Baldwin said, quote, "We have not considered that at this point. We're 3 days into this, and so it's not really time to measure success. We'll continue to monitor and look at this down the road and work with restaurant owners and others to come up with some creative ways to communicate and get masks in people's hands." So far, Raleigh and Knightdale are the only two cities in Wake County requiring masks. UNC Health will now ease its visitor restrictions. Patients who pass COVID-19 screenings will now be allowed at least one visitor to UNC's Health Triangle hospitals. More strict rules were put in place back in the early days of the pandemic in March. In most cases, visitors were not allowed in order to protect the patients. Health officials said they've now loosened those restrictions because of the strain that stopping visits had on families and patients. In a statement, Chief Nurse Executive of UNC Health, Kathy Madigan, wrote, quote, "We recognize that allowing visitors is an important step that can improve the overall health of our patients. Visitors who are displaying symptoms of COVID-19 will not be allowed in the hospitals. This change applies to UNC Medical Center in Chapel Hill, UNC Rex Hospital in Raleigh, and Johnston Health Hospitals in Smithfield and Clayton. Visitors are required to wear masks, and restrictions still remain in outpatient facilities for now. This month, Senate Bill 730 was proposed to try and allow visitors in hospitals. Lawmakers had argued that hospitals had gone too far in banning visitors from hospitals during the coronavirus pandemic. If passed, the No Patient Left Alone Act would override remaining hospital bans or restrictions on visitors. A new report from the Centers for Disease Control and Prevention shows how the coronavirus has been especially devastating to certain communities, including minorities, the elderly, and those with pre-existing conditions. A breakdown by race and ethnicity shows the disproportionate infection rate among Hispanics and African Americans, far beyond their share of the population. Included in the other/multiple races category, American Indians and Alaska Natives were also disproportionately affected, comprising 1.3% of cases while making up only 0.7% of the U.S. population. Hospitalizations were 6 times higher among those who reported underlying conditions, and the majority of those hospitalized were men. For the same subset of cases, deaths were 12 times higher among patients who reported underlying conditions. The most common reported underlying conditions among persons with laboratory-confirmed COVID-19 were cardiovascular disease, diabetes, and chronic lung disease. Deaths were most commonly reported among persons aged 80 and older, regardless of the presence of underlying conditions. There are more than 2.2 million confirmed coronavirus cases in the U.S. Last week, a CNN analysis of data from Johns Hopkins University found that 8 states were seeing their highest 7-day average of new coronavirus cases per day since the pandemic started months ago. And lastly, the national real estate market is starting to show signs of slowing as home sales plunged 9.7% in May, but experts believe the Triangle could be in better shape than most markets in the country. According to new numbers from Zillow, newly pending sales in Raleigh-Durham are up 1.9% from the previous week and 8.6% from a month ago. Skylar Olson, a principal economist for Zillow, said this puts Raleigh far above its 2019 levels, and says that while things have slowed down, Raleigh's quick recovery has been exceptional. Olson studies home trends nationally, and she says she was slightly surprised by the strong numbers from the Triangle, but points to strength before the pandemic as the reason for the continued surge. And she says the types of jobs available in the Triangle, many in the tech industry which allow for more remote work, could add to future growth. Experts say the hot market could continue in North Carolina, but they are warning it's too early to celebrate a recovery. Any shift in the pandemic could also cause a shift in the real estate market. This has been your Coronavirus North Carolina News Brief for Monday, June 22nd, 2020. As always, if you like the information and resources you get from this show, let us know. Leave a rating and review wherever it is you listen. And while you're there, don't forget to subscribe so you don't miss our new episodes. Thanks for listening.